Good evening, and welcome to another episode of Crucial Conversations. I'm your host, Dr. Keith Newby, and I serve as Medical Director of Health Equity with Centera Healthcare, and I'm also the President of the James E. Newby Jr. MD Foundation. Today, I will ask this simple question: does industrial pollution affect African American neighborhoods? With me is my co-host, Jeremy Johnson, who will be serving to monitor the progress of the program and field any questions you may have through the chat or by raising your hand at the bottom of your screen within the Zoom program. Jeremy will provide the house rules. Jeremy?
Thanks everyone for joining. We are streaming this through Zoom as well as Facebook Live. We will be periodically checking the Facebook Live, but if you want to be able to ask questions, please visit the Zoom as it is the most effective way to ask questions. You can access that by going to the James E. Newby Foundation.org, and you can see the registration button there. If you have any questions, just let me know. You can message me at jeremyj@johnrichmedia.com.
Okay, and for those of you who know me, I've always been an upfront person and will always speak truth. As you know, anything we do in life costs money. I've donated all the upfront capital necessary for this program through my foundation. I've told any sponsors that care to jump on board with us that I will not hold back any information I feel is relevant to my community. So if you don't want me to say certain things, this ain't the program for you. Of course, some individuals have backed off, but some have jumped on board willingly. Truist Bank and Centera are two of those companies who have opted to come on board with me and will be sponsors of upcoming episodes. So let's get to it. My panelists: Dr. Timothy Goler is an Associate Director of Research and Scholarship for the Center of African American Public Policy and Assistant Professor of Sociology and Urban Affairs at Norfolk State University in Norfolk, Virginia. As a thought leader, Dr. Goler continually fights to level the playing field by bringing educational opportunities and other issues facing racial and ethnic minorities in academia and community into focus. He focuses on addressing environmental and lifestyle issues, as well as the condition, disparities, and resources linked to chronic stressors like racism and discrimination. Dr. Goler has more than 25 years of hands-on experience in the public, private, and nonprofit sectors, focusing on the interface of practice and research with a particular expertise in the urban context. Dr. Ahmed Witt is an assistant professor in the School of Social Work at the University of Texas at Austin. His research focuses on investigating neighborhood, social, and built environment determinants of health within urban environments, using geographic information systems to inform policy interventions to address measurable neighborhood risk factors, applying predictive analytics to improve outcomes for juvenile justice populations. His numerous publications include spatial analyses of policing intervention and neighborhood revitalization. Dr. Witt serves as the director of the Learning and Evaluation Center for Employment Opportunities as a senior evaluation resource to manage the development, reporting, and interpretation of internal research activities, including but not limited to formative, summative, and impact evaluations. As the director, Dr. Witt executes the CEO's strategic evidence plan to address learning, agenda, and program improvement, including leading research activities, managing external consultants, and assisting with internal and external communication. And finally, Dr. Cassandra Newby Alexander is the Dean of the College of Liberal Arts, Professor of History, Director of the Joseph Jenkins Roberts Center for African and Diaspora Studies, and the Senior Fellow with the Center for African American Public Policy at Norfolk State University. Her focus is on African American history in Virginia, and her book publications include Virginia Waterways and the Underground Railroad, and African American History of the Civil War at Hampton Roads. She co-authored Black America series, Portsmouth, Hampton Roads, Remembering Our Schools, and co-edited Voices from Within the Veil, African Americans and the Experience of Democracy. With over 30 years of community and public history work, Newby Alexander has served as an historical consultant for numerous agencies and initiatives. And this wonderful young lady also happens to be my sister. On my last Crucial Conversations episode, I had my brother with me and now my sister. As you can see, I love working with my family, as both of my siblings have always been high achievers and servants of the community. And for that reason, I truly welcome her input. For those who know her, she is about the most dedicated person who remains a strong voice and advocate for our people, and I truly feel blessed having her with me tonight. I do not say these words lightly about my family because I think we all have some family members that we would never bring on TV or any other media outlet, as we all do. So believe me, when I say if I invite family, you can best believe they are the real deal. So welcome one and all tonight. So, in preparation for this episode, I came across an article in the New York Times entitled Pollution is Killing Black Americans. This community fought back. The first sentence reads African Americans are 75% more likely than others to live near facilities that produce hazardous waste. Can a grassroots environment justice movement make a difference? It talks about a 76-year-old retired behavior specialist named Killen Johnson, who lived in the tight-knit community of Grays Ferry in Philadelphia, who developed gallbladder cancer at a young age. After she recovered from the initial shock of her diagnosis, she began to wonder why she had such an unusual cancer. The CDC estimates that only about 3,700 Americans find out they have gallbladder cancer each year. Breast cancer is usually the most frequently diagnosed cancer in the country, with more than 280,000 new cases annually. Because Johnson's disease was so uncommon, doctors at University Hospital had to formulate a special treatment plan. Gallbladder cancer occurs mainly in older people, and 72 is the average age of diagnosis. She was 46 at the time, so she started thinking, why was this happening? Someone close to her responded, look across the highway, pointing toward the massive 150-year-old refinery owned by Philadelphia Energy Solutions since 2012, and was so familiar to the Grays Ferry residents that it just seemed like part of the landscape. Over the next year, a group began to tally the diseases all around them suffered by people they loved. An uncle died of prostate cancer in 2010, and three of his children, or her first cousins, meaning Ms. Johnson, also had different forms of cancer. 4 out of the 6 people in the household. Those 3 cousins learned they had cancer earlier than age 66, which is the average age of most diagnoses. Other family members found out they had breast cancer several months apart, both in their 50s. One of those same family members then came down with multiple myeloma, a cancer of the blood. So Black communities like Grays Ferry shoulder a disproportionate burden of the nation's pollution, from foul water in Flint, Michigan, to dangerous chemicals that poison a corridor of Louisiana known as Cancer Alley, where scientists and policymakers have known for decades. A 2017 report from the NAACP and the Clean Air Task Force provided even more evidence. It showed that African Americans are 75% more likely than other Americans to live in so-called fence-line communities defined as areas situated near facilities that produce hazardous waste. Another study conducted by the Environmental Protection Agency's National Center of Environmental Assessment examined facilities emitting air pollution along with the racial and economic profiles of surrounding communities. It found that Black Americans are subjected to higher levels of air pollution than white Americans, regardless of their income level. Black Americans are exposed to 1.5 times as much of the sooty pollution that comes from burning fossil fuels as the population at large. This dirty air is associated with lung disease, including asthma, as well as heart disease, premature death, and now COVID-19. Studies have a statistical connection between death rates from COVID-19 and long-term exposure to air pollution. The researchers from Harvard School of Public Health noted that even a small increase in particulate matter, tiny airborne particles emitted from power plants, industrial facilities, and vehicles, corresponded to a significant increase in COVID-19 mortality. And to make even further note, in 1978, North Carolina residents noticed dark streaks along the shoulders of more than 200 miles of roadway. Over that summer, the Ward Transformer Company dumped more than 30,000 gallons of oil thick with polychlorinated biphenyl, which caused birth defects, liver and skin disorders, and cancer in the middle of the night in order to avoid the cost of proper disposal. One of the so-called midnight dumpers went to prison along with the head of the company, leaving state officials and the EPA to decide where to place 60,000 tons of contaminated soil. So what did they do? They chose Warren County, a predominantly African-American part of the state. This community then began to mobilize. Rallies, march, arrests, media attention weren't enough to stop the landfill, but they did galvanize a growing movement against environmental racism. The following year, the U.S. General Accounting Office examined hazardous waste landfill placement and found that Black residents made up a majority in 3 of the 4 communities with hazardous waste landfills in the 8 southern states that make up the EPA Region 4. So with that background, let's begin. I mean, I know that was an earful, but this is the kind of thing that we're seeing far too often. So I want to ask the first question, and I'll throw this out to the group at large. What prompted your the public policy group to look at this as a problem? And I'll throw this out to the group and just tell me whoever wants to take it. Let's start with that. What got you into this in the first place?
Well, I'll take that. Back in 2018, I had a conversation with the Department Chair of Political Science, Soji Akumalate, and I said to him that we need to create a center that would begin to take the research that we're doing and use that research to change public policy. There are so many things happening right now: food deserts, health inequities, legal issues, voting and redistricting issues. We need to make a difference. We cannot just write an article, write a book, and let it sit on a shelf. We have to be activists in what we're doing. In much the same way that the critical race theory created this idea that, yes, look at the law, look at this long history, and these are the issues. Yes, racism was a part of the formation of our legal system. It's been with us from the beginning, but now we're going to do something about it. Let us be advocates to change the system. Just in that same mindset, the two of us got together and we sought funding and were able to get state funding to support the Center for African American Public Policy. And since then, we've received foundation support from other entities to do studies on issues having to do with inequities with regards to African Americans. And of course, with COVID creating a national shutdown and still being an ongoing problem, we said there is something very particular that we really need to start looking at. And these health inequalities are connected with the inequalities in how the Black neighborhoods are treated, how African Americans in general before the law are treated, how funding seemingly doesn't seem to make its way to African Americans, and it skirts over to other communities that are non-African American. And so we need to start looking at these things. So that's how so much of this got started. And we've started putting reports out there to get the community learning a little bit more about what the center is all about, but more importantly, learning about these issues and bringing these issues to the forefront. And this is just the start of what we're doing.
Well, it's like excellent work. I mean, I've learned so much just in the last couple of weeks from, we're looking at the material and just kind of absorbing a lot of this in. I'm actually going to throw out a question since you mentioned issues of health inequalities. A lot of people will hear that term, and I've even had discussions with individuals where we talk about health inequalities. The question I would pose out to the group, and this may be something I think Dr. Gola, you may want to take, is when you say the term health inequalities, what does that really mean?
Well, first of all, Dr. Newby, I appreciate you having me on the show tonight. Health inequalities are the unjust but avoidable differences in people's health across the population and between specific groups, right? Which really goes against this whole principle of what they call social justice, because it's avoidable, right? We can avoid these inequalities, and they don't occur just randomly or by chance. They are what is called socially determined, right? The health inequalities are called they're socially determined, largely beyond the individual's control, right? And so you hear the term also tied to health inequalities, which is a term called the social determinants of health. And these circumstances disadvantage people and limit their chances for living longer and having healthier lives. So that's kind of the, in a nutshell, that's really kind of what kind of health inequalities are.
So when
And
they talk about,
could
yeah,
I
go
add
ahead.
something to that? An example or another example is the way that our health system has organized itself. What kinds of cancers do they screen for? Are these cancers more likely to be seen in white males or Black males? And that's true of the variations of prostate cancer. The three things that they look for tend to be more common cancers, prostate cancers in white men versus Black men. And as a result, Black men aren't diagnosed with prostate cancer until they're in stage 4. So that's an example of a health inequality. Another example is when you have doctors who come to the table with cultural preconceived ideas about Black people. Black people complain too much. Black people can't take any kind of pain. Black people are stronger and can take more pain than white people. So we're less likely to prescribe pain medicines to Black people than to white people. Pain medicines to white people instead of Black people. Or Black people have a tendency to become drug addicts. So we're not going to give them drugs that could help them like we would give white people. So a lot of the health inequalities are coming from a cultural bias that many people aren't aware that they have, but it's 400 years of hearing that Black people are somehow very, very different from white people and therefore should be treated differently.
And one of the things that as a healthcare professional, I run into with debates with some of my colleagues when we talk about this issue of social determinants of health. We talk about financial differences, educational differences, opportunities. I may run into someone of a different persuasion that would make a comment to me, well, if Black people just pull themselves up by the bootstraps, they do fine. Mm. And when I hear that, the first thing that goes to my mind is, well, what opportunities did you have that were made available to you that others may not have had opportunities to experience? When I came back to the area in 1997, and I was trying to get a loan to start a practice, and as a cardiologist, I said, well, I thought my earning potential was actually pretty good, but I had to go to a couple of different banks, and my credit score was over 800. And I kept hearing every excuse. Now I'm a light-skinned dude, but they didn't take them long to figure it out. So I say all that to say that it does make an impact about opportunities, means an opportunity. How do you get access to capital that other people don't have, that other people may not have? So you talk about getting people to come to the doctor. If there's no trust there, it's going to create a problem. And they'll say, well, we gave this person opportunity. I think there came up an issue of like bypass surgery. I think that was studied several years ago, that Blacks and whites, in terms of those differences between the two groups, getting access to bypass surgery. And they came to a comment to say, well, we offered it to African Americans, but they didn't accept it. The thing I say, well, you got to ask yourself, why didn't it get accepted? What were the issues at hand that prevented that from occurring? And a lot of times you'll find it's a lack of trust. So this is, even as we look at vaccine hesitancy in COVID-19 treatments, that is a big issue. Is the hesitancy comes as a result of lack of trust, and that lack of trust comes from the issues of the past. So I bring that up to say, as it relates to those social determinants of health, they do make an impact. And please, anybody else that has comment, jump right on in.
And I'll just let me just add to that. We're talking about pollution, right? For instance, pollution is a determinant of health because it impacts a person's, adversely impacts a person's health, right? And so is things like exposure to crime and violence and social disorder and access to education and job opportunities and healthcare services. These are all these things in aggregate, even in individual basis, ends up affecting a person's health, right? So when we think about, pollution in and of itself, it is multifaceted. It's just not one, when we talk about, you know, how do we get to these conditions, right? If you think about African Americans in and of itself, how we migrated, the Great Migration, right? The Great Migration was happening during the same period of time as Jim Crow, right? During the same period of time as the Industrial Revolution, right? So all these things, conflate in a way that on top of what structural racism that plays
And
out.
Dr. Goller, they just to piggyback, when we look in the literature, and when I say literature, I'm looking at like big statistical studies of different populations and subgroups. They organize those determinants in three ways, right? There's the things that you laid out that directly impact individuals' health. There's what Dr. Newby broke down of the things that impact someone's access to healthcare. And then kind of this large bucket that I think we all touched on is things that prevent, or unjust or unavoidable things that prevent healthy behaviors. And like, that's always the bucket where people shirk, or organizations or companies shirk responsibility and say, hey, it's a behavioral issue, but if I have all these barriers or all these reasons why I'm not just going to pick up an apple, or I'm not just going to exercise an extra 30 minutes a day, then whose responsibility is it to protect individuals, or at least hold people accountable for those barriers?
And I want to say Dr. Witt makes an important point. In Richmond, for example, for 100+ years, the Medical College of Virginia used African Americans, many of whom were enslaved, but they also used some free blacks. Some of them were kidnapped off the streets. Some of them were sold to that institution by their slaveholders when they got too old, or maybe they just enticed them and they wanted to experiment on Black people. And so for many in that community, a hospital for them represented a place where they could be experimented on or die. And even in death, they were not safe, because MCV had grave robbers that they paid to go and dig up freshly buried bodies and bring them to that institution as cadavers, and they continued to defile them even in death. And so a lot of communities have experienced this ongoing exploitation of their bodies by the medical communities. And so now you're asking people to trust those very communities that either they have personally experienced, their families, or maybe they've heard of someone who has experienced this kind of exploitation. So, and oftentimes there's a big leap that we're asking people to make without actually fully correcting the behavior of exploitation.
It's always interesting to hear that this stuff actually happened, and it's reminiscent of the old Frankenstein movies when you really think about it. But having said that, I want to ask this, because I know we talked about, we touched on some of these pollution aspects, and I want to bring up as it relates in Hampton Roads specifically, and I saw some of the slides you guys have formulated about some of these hotspot areas. Can someone talk a little bit about what are some of these hotspot areas locally? What types of industrial pollution has affected these areas, and what type of health problems have come as a result? Anybody want to take that one on?
Well, I'm happy to jump in. I don't know if you can bring up this particular slide, number 11. Yes, thank you, Jeremy. So I selected these three pictures because these are three pictures of what is happening right now in Hampton Roads. The top picture shows you what's happening at the Newport News shipyard, and that's coal. And even though they had that water blowing down on the coal, the wind blows those particles in the direction where the Black community is concentrated in Newport News. And you see a higher level of cancer rates, asthma among children, high, a low birth rate with infants, higher mortality rates, as well as a whole host of other problems coming from that coal dust blowing there. In the Lambert's Point area, you see the same thing happening for years, that coal dust blowing into the Black community that was living there and resulting in a lot of health issues. The middle picture is the power plant in Chesapeake, and of course in Portsmouth. And so wherever you have these shipyards, or wherever you have these coal plants, you have all these pollutants, and they're all located right there by the waterways, which is so amazing to me, because somehow we're supposed to believe that these pollutants aren't also getting into the waterways and into the soil, not just into the air. And all of these factories were located close to, if not next to, African American communities, and they came after those communities were there as opposed to before. So that meant that the local communities or the state rezoned those areas to allow those businesses to be placed right there in those communities. And this is what really harms African Americans, because they often are not the majority vote on city planning commissions or on city councils when these things are done at the city level, and they're definitely not there at the state level.
So that third picture at the bottom, what is that again? Where is that?
That's in Portsmouth.
Okay. And I bring this up because there are times I live in Larchmont, so I'm right close to Lambert's Point area. And there have been times I know I've walked outside on my back porch and I see this black stuff all on my house. And I'm like, where is this stuff? And my wife Peggy would say, well, that's coming from the coal area. That's what that is, coal dust. And and I am on the other side of Hampton Boulevard. I'm not even on the Lambert's Point side. So that means that stuff has to blow clear across several neighborhoods to get to my house. And this can be kind of thick on the house. So I'm sitting there wondering, why am I coughing all the time and I have all these allergy problems? And I would not be surprised if that were in fact part of that. The problem is this environmental aspect. And I've been on, went on somebody's boat one time and saw in Portsmouth and saw a pipe and just something out of one of those buildings just being dumped in the water. And you see this stuff all the time. And the first thing that went through my mind is, how can this be legal? I mean, they're dumping water. I mean, some kind of pollution in the river here. And it amazes me. And where did the legal aspect come that allows these people to do this just openly like that?
Well, I'm just going to piggyback too about this, how this pollution, how in these environmental conditions cause harm. It usually causes harm, again, to people who are in low socioeconomic positions, that have less education, and the main sources are also things like even our own homes, particularly when you live in older communities. You might have homes that are full of lead, or live near landfills, beyond factories. Also, I mean, a lot of times we think about it from the standpoint of urban communities, but in agriculture, I mean, we live in a community, we live in a region where, there are a lot of agriculture, so, the pollutants and the contaminants that they use in that field, along with transportation, right? So there's so many different sources of contaminants that ends up affecting, can have an adverse effect on the health of particularly low-income communities and folks that are not able to advocate for themselves.
And I want to also bring out another point. If you go through one of the tunnels, the downtown tunnel or the Midtown tunnel, especially, those two tunnels in particular, they get filthy very, very fast because of the number of trucks with their diesel engines going through. Now imagine if those tunnels, after a couple of weeks after cleaning, those tunnels are filthy again. Imagine how many pollutants are being spewed out into the air, you know, and a part of our environment, especially in the summertime when the humidity level gets really, really high and it sort of sits in the air and we're breathing that stuff in on a daily basis. Imagine the harm that it's doing. So all up and down Hampton Boulevard, which is why many of the residents there were advocating that these trucks not be allowed to go through, because they recognize that that was creating a real harm in the health and well-being of the citizens. But then the downtown tunnel, it's going straight through area where a lot of African Americans are concentrated, and they're being exposed to the same thing, and not a peep has been heard from, you know, from the newspapers, and people have been protesting this, but not a peep has come out. They're exposed to the same level of contaminants. And in fact, there are a higher percentage of children in those areas because those contaminants create a lot of asthma. And we have a higher rate of asthma in this area than most other places. And it's because here we are, the Port of Virginia. And with the port, you have lots of diesel powered engines.
Yeah,
just to put a little, if you don't mind, just put a scale and a context to the magnitude of the harm. We know that nationally, these contaminants contribute to about 100,000 deaths that we can actually link to these contaminants a year. Now, this is nationally. I don't have the Virginia numbers. And we also know that Virginia is one of 19 states where African Americans, controlling for all other factors, African Americans are 79% more likely to live in areas with these contaminants as compared to whites. So we know that the magnitude of what we're talking about, and we now have the science to directly link death, not just in addition to asthma, in addition to instances of heart attacks and lung cancer, actual deaths yearly to the specific fine particulate matter at the 2.5 level.
And we haven't even talked about how these airborne contaminants conflate or compound COVID-19, which is also an airborne disease, right?
Well, anytime you have one of the things, I guess I've become, I feel as a practicing cardiologist, but I feel like I've almost become an infectious disease doctor over the last year because of the level of exposure that I have to endure and see in patients who have died of COVID-19. And, you know, if you see some of the deaths, the question that comes up, and it's been brought up, is, you know, how much of this is affecting patients to the point where they go on to die, comparatively speaking. I mean, you have to do, of course, you know, randomized studies looking at that. At least you could do a case control looking at least getting an idea, which I think they have done. You know, the downside is how you define it. And I want to ask this question out to the group. You know, when I've heard this and I say, okay, you know, you hear, if you live in certain areas, you may see these health challenges pop up. Have they actually looked at neighborhoods that may not be exposed, that have similar demographic makeup, to show that those that are exposed versus those that are not exposed have the more health-related problems? In other words, if you have, like, say, two African-American neighborhoods, different areas, same demographic makeup, same economic makeup, one exposed to pollutants, one not, do you actually, has that ever been done that you can see there's a difference in those two groups? That's the part. I could not find any information that specified that. Does anybody know?
Well,
I'm
I'll
not.
just say,
Oh,
Go.
Trevor, go.
go ahead, Emmett.
No, I was going to say that I haven't seen studies that compared actual neighborhoods, but I have seen studies where we're looking at individuals from a range of neighborhoods with similar characteristics. So if you think of like a large regression where you have individual factors and neighborhood factors, I have seen studies where we've parsed out the unique effect of neighborhoods, but that's kind of naturally representative sample. So the actual breakdown of similar demographics, but geographically different, we can kind of we can make some assumptions from those type of studies, but I don't know if I'm familiar with targeted studies that look at that specific
Yeah, I
question.
mean, I just think that it would have definitely more teeth, because everybody would then say, well, yeah, you may say that, but, then they may have these other, because this typical corporate America will come up with these rationales why they can explain why this is going on. I think will be an interesting study. It can be looked at least hospitals could potentially do if you can identify hotspots, because a lot of these hospitals, they get people come from all over the area. So if you get like an address, the only issue is, people change addresses a bit.
Well,
So,
I
trying
would,
to
I would venture to say, though, based on the research, that when you're looking at these urban communities, right? An urban community in Detroit is the same as the urban community in Cleveland, is the same as Washington, D.C., Atlanta, Chicago. So it depends on, when you also how a community was migrated and developed, right? So you're going to get a different type of so if you're going to compare, for instance, industrial Midwest cities, the Rust Belt, with Atlanta, for instance, you're going to get a different dynamic because the cities are not the same, right?
Well, I'm thinking more in the Hampton Roads area specifically, like, like say if you look at areas of Chesapeake versus Virginia Beach, and it may be that I said, and you guys may know this better than I, like what are the hot spots around here? The question is just if you have similar neighborhoods that, have similar demographics, one exposed, one not, or one near some plant and one not, it would really give teeth to be able to prove a point to say that, listen, we compare these two and these, because people will use all kinds. They say, well, the health of this neighborhood is bad anyway. They have obesity rates, there's a lot of hypertension, diabetes in these areas. That's why they have a high mortality rate. It has nothing to do with environmental aspects. And I agree that I know it has to. It's just being able to show that there is a difference gives more teeth to the points that come up. And again, it will be an extremely hard thing to do, just because you got people move here, there, everywhere. They may pop from one neighborhood to the next. So it's hard to really categorize that, but it sure would give teeth.
And it's multifaceted, right? So when you're
Yes.
talking about communities that are, when you're talking about socioeconomic conditions, for instance, right? You want to talk about concentrations of poverty and the stressful conditions that accompany something like that, right? I mean, so so it would be interesting, all things being equal, right? I mean, it would be an interesting study to look at, particularly here in this region, given how kind of you look at Norfolk as the central city. Right. That's what it seems like to me anyway. It's like Norfolk is the central city, and then you have these other cities that either engage or don't engage.
Well, the challenge is that all of the historic Black communities in Hampton Roads have been harmed by environmental racism. Every last one of them. And even those areas that were developed, W.T. Mason, for example, developed the area that we know as Anna Street, which is right in the middle of Norfolk Industrial Park. And it was placed, it was designed, that was the only area he was allowed to develop. He owned Norfolk, and what we call Norfolk Industrial Park. And Norfolk basically strong-armed him into selling that land, or they were going to condemn it and take it from him. And so they allowed him that piece, but then they surrounded that with some industrial things. And so how do you compare that? That's one of the oldest. Another old neighborhood built around the same period is Cavalier Manor in Portsmouth. How do you compare those two areas? Or you have L&J Gardens in Virginia Beach, each of them near highways, each of them near areas where the flow of air is similar, and they have similar socioeconomic levels, and they have similar healthcare challenges. Now, how do you compare that with going to the traditional Black neighborhoods under segregation, those neighborhoods that were redlined? So when we talk about Tidewater Gardens, for 300 years, that area has actually been dominated by African Americans. It didn't just miraculously appear. It was taken over by the city. This was land owned by Blacks, taken over by the city, and then they placed low-income housing projects on that land. And then they continue to segregate and marginalize those individuals with few to no resources provided to them. And then they surrounded it with a lot of industry. They placed a highway next to it. They did all these things. And of course, that land sits 12 feet below sea level. We haven't even talked about the impact of seawater rising on Black communities and the health issues, because when it floods, it brings all kinds of health challenges to those communities. And so it's kind of hard to compare or see any difference, but I think it would be interesting if we kind of snapshot some things. We're going to have to compare some of the newer communities that have been developed with some of the older ones that have long-term systemic environmental injustice issues. But I think it would be interesting to see if we're seeing the same kinds of health issues, because if we don't, then we can point directly to the environment as being, something that has created these health challenges.
All right. So Jeremy told me we have a question from our listening audience. So Jeremy, you want to go ahead and share the mic?
Yes, I'm actually promoting Barbara Ham Lee up to panelist. I think it's happening now. So you should be able to, she's on now. Just hit unmute and you can give us your question, Ms. Lee.
Hey, good evening, everyone. This conversation is fascinating. And I've thought about, Keith, as you asked that question about whether a study had been done. I know the Robert Woods Johnson Foundation did a study where basically they can take your zip code and determine, based on zip code, the types of health issues that a community may have and so forth. And I'm wondering if that might be something that could be lifted up as they advance that study to also include environmental issues, to see whether or not that plays into that same area, because they can literally take the zip code of a person and determine length of life, the types of issues that they may have in terms of social determinants of health. And so that might be another aspect to add to it.
Yeah, that'd be great, because I mean, a lot of this stuff is trying to really sort through how do you demonstrate? I mean, we all know that these pollutants do impact, but everybody always has I guess a comeback to say why it's not this, and you get a lot of people who are company people that will come back and have every excuse in the world why that's not the case. It's just, it gives teeth if you can demonstrate it, even short-term stuff, because you look at asthmatics, a lot of times those are more reactionary situations, like if you're exposed for even a short period of time. And I give you a prime example. I have bad allergy problems. I've always had that. But I remember a few years ago, my wife took me on a surprise trip to New York to go to Phantom of the Opera. This is back in 12. But I remember I was hacking and coughing and just carrying on. And my wife was like, "Are you gonna be okay going up here?" And I said, "Yeah, I'll be all right. I'll be all right." So we got on the airplane in Norfolk. I got to New York and the LaGuardia, got on a cab. As I was driving, we were going into the city, probably about maybe 30 minutes after landing. She was like, "Man, I heard you cough any." And I said, "I haven't." And that whole weekend, I didn't have any issues, no sinus problems, no coughing, no nothing. We got back on that plane. Time I went to get my bag, I guarantee you, as I was waiting on the bag and I was walking out to the car, it started back up. That told me right there. I mean, people can tell me all day long, I don't know what I'm talking about, but I know what I experienced. And it was clear, determinate difference between here. And I would have thought New York, I would have been doing all kinds of stuff, but actually it was dead of winter. It was 12 degrees in New York, so I was freezing my tail off. However, my cough, my sneezing, everything just went away that whole weekend and did not start till I got right back into the city. So I know that there's an issue here. Now, those short-term things are easier I think, to look at. Cancer rates are going to be slightly more difficult because of change of environment, and that's usually not a process that happens quickly. But I clearly would like to get my hands on that. If you have a reference, Barbara, that would be great if you had that for that Robert Wood Johnson
Okay.
Foundation, because I would love to
I've
see
worked with a couple of the researchers, so I'll send you some information
that. That would be
and
absolutely
see,
great.
it might be a possibility to
And
continue
I
that
and I
study.
appreciate I appreciate you coming on.
Oh, absolutely. You know I hate
Barbara and
being
I
here.
work together all the time, so this is like great when I saw her name pop up. So this is the kind of thing that we both try to do, which is help educate our community and really try to get everybody engaged so that at least you understand what your challenges are, and that don't just think because you feel a certain way if you've experienced this health issue that is not based on your living conditions. One of the things. Go ahead.
And I want to say, I want to speak to Barbara's point. Zip code, right? To your point, has consequences where you live, right? We talk about racial, residential segregation, right? We talk about segregation. Living in, if you live in a zip code that is impoverished, right? This, can adversely affect your health from a broad range of things, right? Residential segregation and being in impoverished communities can lead to a lot of different neighborhood issues. For instance, in poor neighborhoods, we usually have poor political leadership. Boom. I mean, we usually have poor services, a disinvestment, right? We have issues where we have a lot of pathologies that we don't talk about, right? Overeating, uh, 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 alcoholism, all these things, right, that play into living in poor schools, right? So all this, the higher likelihood of violence and crime and homicide, all this stuff plays out into living in particular zip codes, higher levels of female-headed households, right? So all these things need to be taken into consideration when we look at living in communities that are segregated, or zip codes, one zip code versus another, right? And class issues, if you want to talk about it in terms of African Americans, right? Let's just get straight to it. We have our own class issues, right? So we got folks that look like us living in communities that don't look like some of the communities that some of us are living in. So segregation and residential segregation is a big, big issue that we have to figure out how to address.
One point I wanted to bring up, and of course, I have always have a hard time trying to call you Dr. Newby Alexander, but I'm a struggle through this talk tonight. But I wanted to ask, you brought up a issue when you talk about how do you create the living environment in which people are exposed. You mentioned about a prior president setting a stage in which almost pushed African Americans in certain neighborhoods. Could you enlighten us again about what you said earlier?
Sure. When uh, Tim mentioned, Tim Goller mentioned at the beginning of our discussion about Jim Crow and racism, and we know that segregated housing began essentially when Jim Crow began. And we would see this policy adopted by a lot of cities. Richmond adopted it in 1911, Norfolk in 1914, where they started segregating African Americans. And it was really hard in Norfolk because Black people lived everywhere, but they were concentrated in certain communities. And so the map that you see on the screen shows you where Tidewater Gardens is now. That historically was an area where African Americans had lived for at least 300 years prior to that. And so if you go there and then you go to the next map, it shows you that pretty much this is where people continue to live. So even though the Supreme Court struck down all the residential segregation laws in 1917, we would continue to see the cities using either their police force or the real estate agents or simply mob violence to keep Black people from moving into other areas. By the time we would see redevelopment happen, and Norfolk would start redeveloping the city in the 1930s. And so they would simply mow out, just completely destroy Black communities when they wanted to move them out of an area. And they would couch it under the terms of redevelopment. And then, of course, in 1945, where we had the Norfolk Redevelopment and Housing Authority, they were really known for using that agency to move Black people, to move Black businesses, to destroy the Black economy. And they would do so time and time and time again. But it was in the 1930s, 1933, when Franklin Roosevelt was elected president. He created what we know of as the New Deal program. And a lot of the New Deal helped African Americans, but a lot of the New Deal hurt African Americans. And one of those agencies was the Housing Authority, the Federal Housing Authority, the FHA. And that authority in 1934 was put in place. And what they wanted to do was to create wonderful suburban communities that would be exclusively for white, middle, and lower middle class people. And they would provide vouchers to builders to incentivize them to build these neighborhoods. But the caveat was that they would not get any federal funding if any of those neighborhoods was located close to where Black people lived. And so Black people were forced by the FHA to remain in urban areas, and they would penalize them if they moved or tried to move out of those urban areas. And so in Norfolk, you would see African Americans seeking to create their own communities by buying land outside of the city areas. So they would buy land in the county areas and try to develop their communities at that point. But then once those areas were annexed, they would have difficulties and they would be redlined. And because the FHA also worked with the mortgage companies and said that those areas that had African Americans dominating, those were high risk mortgage areas. It did not matter what the socioeconomic level was of Blacks. They were a high risk area. You don't want to invest in them. You want to charge higher mortgage rates because they're a bigger risk for you, or you don't want to fund them at all, which meant that Blacks could not, in some cases, earn enough money to put up the full amount that it would take to buy a house. And so they had to continue to rent. And so they lost wealth for generations because they weren't able to do that. And in addition to that, with the FHA, they would, working with these mortgage companies and with the real estate agents and realtors, they lower the value of the houses. So African Americans could not actually gain wealth and equity, home equity, through where they lived. It didn't matter what the house looked like. They still couldn't get the value. And by the way, while that was going on, the cities would actually tax Black people's houses at a higher rate than white people. And they knew they couldn't get that amount of money for their houses. So Black people, in addition to those very discriminatory laws having to do with how whether they could get mortgages on their house, how much they had to pay, the insurance and so forth, they actually pay more money in taxes on average than any white person in the entire city. And this went on not just in Norfolk, this went on throughout the country, and it is still going on today.
So did that end up leading to this? I don't know if this was coordinated out, but sounds like a lot of situations where they pushed African Americans in certain areas. Now, did the industrial park come as a result of that, or prior to that, and they just got pushed to these areas where these companies were located?
It was a combination of two things. In some cases, those industries pre-existed. In other cases, they simply allowed those industries to be zoned in to those neighborhoods that they were currently occupying. So both things happened. The issue was that Black people could not leave the cities. They were forced to live in these urban deserts. And I call it a desert because that's where you didn't have any green space. There were no parks there. And so the average temperature, and this is still true today, the average temperature of a lot of these traditional Black communities is 10 degrees higher than the average temperature in the white communities that are sometimes 5 miles away, still in the urban area. But because they have parks, tree-lined streets, lots of foliage that's maintained by the city, they have a lower temperature rate than in the Black areas that have a lot of concrete, very few trees, and almost no parks.
Wow. So I have two questions I wanted to throw out before we end the episode, because we're getting towards the end. I want to direct this question to Dr. Witt. I know you're down in Texas. So what's the environment like there in terms of, do you find similar situations in Texas than we have here in Virginia? Are they different? How is the kind of the climate, so to speak, down in Texas?
I think where there's similarities, and I spend a lot of time in Austin, Texas, and also in Washington, D.C. But when I think of what Dr. Newby Alexander was just explaining, what's interesting is when you think of what these zones are of disadvantage, and it's combined disadvantage of the pollution and also the lack of investment, we see this pattern of sacrifice zones that disproportionately affect African-American communities across the country. But where it really becomes kind of dastardly is that you also see certain types of industry incentivized by the government to pollute or to build factories in these areas. So it's kind of going in two directions. You have the historical impacts of the particular community, and now you also have government incentives to put certain types of businesses some places, and then cutting off both economic opportunity, but also increasing the likelihood of pollution. So that pattern I see kind of across the country, including in Texas. But what we're doing with the actual space and what those industries are is where there's a bit of differences. But this idea of a sacrifice zone that just happens to be predominantly African-American is a consistent pattern.
Wow, interesting stuff. The last thing I want to pose out, because I know people who especially live in Hampton Roads who may be on this tonight want to know is, do I live in one of these neighborhoods that I have to be concerned with? And Dr. Newby Alexander, you listed some, and I think Dr. Goller may have talked about it, but if you could define some of the hot spots in the Hampton Roads area, and not in detail, but just some of the areas that would be considered hotspots for this, just so people are aware, because I'm going to end with the idea of people getting more involved in their local politics of what's going on. And I think that's going to be extremely important. But what do you guys, what areas would you advise people to say you are living in a hotspot? What would those areas be roughly?
Downtown Norfolk,
Okay.
downtown Portsmouth. Those are two hot spot areas. Uh, but by the shipyards,
Okay.
anywhere near any of the shipyards, those are hot spot areas. Near any coal fields. The more rural you get around here, the safer you are. I live in an area of Chesapeake surrounded by Portsmouth. The average life expectancy in my area is 3 years more than in the Norfolk State, downtown Norfolk area. And so, you know, and it's strange because right as you get into Norfolk State, it's a little healthier than the downtown area. And part of that is that industry has been in that area for years, and it has not, the contaminated soils have not been cleaned up. And on top of that, you have frequent flooding, which then repollutes that area on an ongoing basis. And so those are the key spots. You know, when you get into Hampton and Newport News, the same thing. If you're near any industries, those are hot spot areas. When in Chesapeake, down Military Highway, I just see that whole area as a hot spot area. But especially where you have the smokestacks, you have all of the coal producing, coal factories and so forth. Those are hotspot areas. When you're near the train tracks and you have a lot of that, like those train station areas, those are hotspot areas because you have a lot of contaminated soil there.
Okay. Well, so I know we're at the end of this. Anybody have any last words before I close the session tonight? I wanted to make sure I give everybody an opportunity to speak now, forever hold your peace.
I will share a quote.
Can't hear you, Tim.
Oh, wait. Can you hear me?
Yes.
Yes.
I will share a quote, and this is a quote I use with my students, and it goes, when the flower doesn't bloom, you fix the environment in which it grows, not the flower, right? And so I think that's a very powerful quote when you think about pollution in our environment, right? It's when the flower doesn't bloom, the flower being the people. You fix the environment in which it grows, not the flower. So it's just something to think about.
All right. So I want to just close by saying this. The point of tonight was not to scare people, to tell them that you're on death's doorstep, to give you this gloom and doom type of situation, but to make you aware of the real possibility that you could be affected by pollution that is currently being dumped in your area of living. And you need to be aware and you need to get involved. I keep saying this, we are notorious for complaining and doing nothing if we're not getting involved in the politics of our area. And a lot of people talk about national politics, but I'm going to tell you, local politics is where you're affected the most. And you need to be involved with your city council meetings. You need to be involved with your planning commissions where they're designing new areas of building and homes. Because again, if you're not a part of that, if you don't speak up and speak your mind as to things that may affect you, how can you institute change? You can't. So I would say this, make sure, and I say this as a doctor, first and foremost, to make sure that you get yourself evaluated and checked. Do not assume because you don't have symptoms that things are okay. If you know that, based on, you go outside and you see, like I'm seeing coal dust on my house. I mean, if you're seeing things in your neighborhood that have potential, if you have power lines up, if you see, dumping grounds, landfill areas, this can affect you and may have already affected you. So you want to make sure you understand the dynamics What's your neighborhood like? What's your demographic like? What are the health challenges that you have? These are the things that our role is to help you be a better you and to live your best life. So again, this is Dr. Keith Newby with Crucial Conversations. Again, this is a crucial conversation, and I hope that everyone saw the benefit of what we tried to do here tonight, which is to educate and to make you aware. So Jeremy, we're going to end it here. And Jeremy, if you would tell everybody if they want to see the broadcast, where they go to see things, to get the recording of it, to have access to it, give us the rundown so we can make sure everybody's aware.
Absolutely. You're going to go to the newbyfoundation.org. You can look under the news tab, or you can see on the homepage, we'll have a link to the recording, which should be up no later than Friday.
So I wanted to thank my panelists tonight, Dr. Witt, Dr. Goller, Dr. Newby Alexander, for a very enlightening discussion. And I learned a lot, and I hope you did as well. So thank you very much. And listen, you guys have a safe, good evening. Thank you again.